Hello, everyone. Welcome to our channel, Melange Musings. As I promised you, I would come back with good topic and in conversation with many eminent people. So, as COVID pandemic has hit all of us so hard, especially the second wave, and most of people are suffering from stress, anxiety, depression due to global pandemic. And I'm sure by 2021, end of 2021, we will have many participants suffering from a serious mental illness compared to 2018. So today, and many the pressing need of many parents is like children concerned with their mental and physical health. On this note, today I have Dr. Brunda Girish. She's a well-known psychiatrist, and she has more than 15 years of experience. She worked in NHS London, and now she currently, from past 4 years, she's a consultant in NHS as a psychiatrist. So right away, I'll jump into it, and let's welcome Dr. Brunda to our channel, Melange Musings. Hi, Brunda.
Hi, Manju. Thank you very much for inviting me
Thank
for
you.
this
Thank you
talk.
for accepting our invitation and spending your quality time with us. Um,
Pleasure.
yeah, as Brunda, you are a psychiatrist, and we, as most of us, have one of these queries about today's very pressing need is children's mental and physical health. As you know, the entire year and a half has been, the kids have spent attending online classes with no clues on when the schools will reopen, especially here in India. So, in this backdrop, what kind of an effect could this continued remote learning have on kids?
Yes, Manju. I think it's been a very difficult year with this unprecedented times with the pandemic. Clearly, children have been affected much more compared to the to the general population because the way it has affected them. Children, there has definitely been an increase in symptoms of depression, anxiety, and also in very rare cases, symptoms of psychosis, and also very sadly, also an increase in suicide thoughts and suicide rates in more teenagers. So with the younger children, again, it's more about the pandemic, not being able to socialize in the normal ways and affecting their milestones, affecting their ability to interact with children and generally just making sense of the world. And for children who have been to schools, they clearly are missing their peers and missing playing together, and which really has a huge impact on how they are able to cope. So I think overall there are some positives in that they have been very good in terms of showing resilience and also positivity and coping with all these changes. And but also I think the effect of it and continued learning will have an impact on the long-term mental illness for children in terms of depression and anxiety, as I've talked about. For the teenage children, I think it's more about not knowing what their future holds, which is a huge worry, giving their exams or career choices, and sometimes even perhaps put back on a year, losing a year out to perhaps resit their exam. So I think all of this is going to have a huge impact, not just with the pandemic lifting, but I think post-pandemic as well. I think these effects there is going to be an aftermath of all these
Wow,
things.
that looks like little concerned area. And follow up to this question, like what can we as a parents to do help contain this negative effects of remote learning on kids? or make this remote learning more effective on our children?
Clearly, I think we've already been through half of the pandemic, and understandably, it's not been an easy task for any of us. As parents, we have our own anxieties about children, about managing work-life balance. So I think as parents, perhaps understanding and acknowledging that this is a different situation that you're in, and with children, because they are so much more anxious, perhaps as parents, being much more patient and understanding about their difficulties, and supporting them in terms of giving them more positivity, perhaps having some increased family time as parents, spending more quality time together, and also having some space as a parent, to talking to your child, how they're feeling, what they're going through, perhaps giving your own examples of how you've dealt with. Um, so I think all of that would be helpful, but also as parents, not beating yourself up if you haven't been able to do certain things, because as a parent or a mother, as me as a working mother, we do carry a lot of baggage of guilt that you perhaps are not being good enough. So I think not stressing yourself too much, because that will also have an impact on the family life, which in turn has a spiraling effect on everybody. So just do as much as you can. Don't beat yourself up. Don't feel guilty. We're all in the same boat, and I think we will get through. So I think it's important to understand and contain your um, anxieties. And again, if you're not feeling like you're coping, then see a counselor, talk to somebody. I think that would be really, really helpful. I think people perhaps don't realize the impact that would have on how a counselor would be able to help them cope.
I think, as you correctly said, that we can't take that guilt feeling that we are not good enough, not well, things. Yeah, I think all of us are. It's something nobody has even imagined. This something like this would come up, and I think we learn together and cope with this and learn to emerge beautifully, I think. Yeah. So
Absolutely.
how do you identify this sign in our kids that they are facing this kind of mental and emotional challenges and beyond what they can cope up and, you when they need to seek the help?
Absolutely. I think children are generally, quite good in being able to, they're sad 1 minute, they're happy 1 minute, but when things are being much more persistent, when children are, sometimes, perhaps more of warning bells would be that, your child is just not feeling persistently sad, or unhappy about things, not really enjoying things, becoming much more easily irritable or snappy, not willing to spend more time with family, or openly talk about their feelings, difficulties in their sleep. They may be sleeping excessively, or they may be sleeping very little, or there may be other symptoms that children may be excessively eating. Some people go as stress binging or stress eating, which is not uncommon. But yeah, if there are changes, and if there are changes to your child's grades, that they perhaps are have been very good, but suddenly you see that their grades are dropping, and also not concentrating enough during lessons. But the concentration again can be due to a number of reasons. Some children have more of neurodevelopmental difficulties, which generally makes them feel or makes them difficult to concentrate. So I think those are some of the things that as parents to think, when there are difficulties, that you notice some of these symptoms.
Okay, okay, that's nice. Yeah, of course. We can't go very elaborate on this. And some of the signs that parents can pick up and seek help. Who would we consult when we identify such need to see an expert? Is it like a counselor or a therapist or a psychoanalyst or a psychiatrist? This whole, like, medical media is so much mysterious to many parents who are not aware of these fields. And could you, share some light on whom we to see first and how this process?
Yeah, absolutely. I think, as I said, being, first of all, being aware of the difficulties. And if there are some difficulties, then I would certainly suggest, well, counselors or even psychologists, qualified psychologists will be very good to start with, because often, children's problems are mainly due to them, due to their feelings, or them not understanding their thoughts or your feelings, which is affecting their behaviors. And I think psychologists can do a brilliant job in perhaps just unpicking some of these things. And I think, yeah, as I said, perhaps come to people like you, Manju, with regards to therapy sessions. And also, I think, they can have individual therapies as well as family therapies. So as an anxious parent, certainly you can go for family therapy as well, whereby, as a family, you understand the dynamics
Yeah,
of the child. um,
could be open to seek help. Yeah, I think.
Absolutely, seek help.
Yeah. So this is like, any and differences that people. Okay, I would say, since you are a psychiatrist, and so how the psychiatrist would help than the like counselor or than a therapist. Could you share how this consultation typically work and what to expect from?
Sure. I mean, as I said, as per, I'm talking from NICE guidelines, or even, the guidelines from the Indian Institute of Medical Science, would be that children often, we would prefer more of therapy sessions. But again, in some children, they definitely, perhaps, the symptoms are persistent, and we may have to even consider medications. So the medications are limited, but for some children, we definitely would consider the medications that we would be considering. And the licensed medication is something called selective serotonin reuptake inhibitors. So they are antidepressant medications, and fluoxetine is one of the medications which is licensed to be used in children. But as I said, we often would try to see, if there are, if symptoms can be improved through psychology. And then certainly, some, we can consider medications for children. And as I said, some of the children with neurodevelopmental conditions like autism and ADHD, they are children who are much more prone to having those depression and anxiety symptoms generally, compared to the general population of children. So they certainly will have much more of an impact with symptoms of depression, which may need more of a medical treatment.
Yeah, it's very well said, Brunda. Since my next conversation will be with the behavioral therapist, I think, and going with the handling the behavior, especially the current scenario. So I thought there will be also a good person to contact and have a conversation now.
Absolutely, absolutely. I think it all goes hand in hand
Yes, yes.
with the medications. As I said, limited role of medications, but again, it's more of talking therapies and behavioral aspects of management.
Yeah. So whenever you prescribe children, so you also advise them to go with the therapies and the counselor hand in hand as it goes always with that. That will be
Yeah,
more effective. Okay. So would you suggest
definitely,
that? Okay.
definitely, definitely.
Okay. Okay, and as a practicing psychiatrist, what has been your experience and learnings over the last year about the pandemic?
Yeah, I mean, it has been very, very difficult, as understandably, there has been an increased need for mental illness and mental support, and I'm talking from a UK perspective.
Mhm.
But we've definitely had quite a surge of referrals which we have had to deal with. So me and my team have been working tirelessly throughout the entire pandemic. Again, I think there's been a lot of goodwill, support from the society as well, lots of volunteering services who've also offered to help. So I think combinedly, I think there's certainly been an increase in the symptoms of depression, suicidal thoughts, psychosis, and just generally, people just struggling with isolation, and so it's been much more difficult.
Obviously, especially the second wave, lot of PTSD, post-traumatic, people are having a lot of the grief and things are pretty bad. And good, so probably this would, be a good help for if people of our viewers. And what's your final words of wisdom or your advice to our viewers?
I'm sure we'll all get through this, but just be patient. Certainly, if you need help, then don't hesitate, because I think mental illness does have stigma attached to it. People worry about seeking help, but it is just like any condition. I think you should talk more about it
Yes,
and seek help.
yes, okay.
um, yeah, I mean, it will be helpful. I think mental illness is one of the more difficult conditions that people struggle on a day-to-day basis, which needs more emphasis.
I think people are more aware of it and being helpful to it. We see more of such act in the coming years, and yeah, seek help. Anyway, thank you so much, Brunda, for your valuable time with us, and thank you for gracing your uh, coming and talking with all of us. Thank you so much.
Thank you very much, Manju. You've been a pleasure to talk to, and thank you for inviting me.